Go for it.
All right.
This is Brock, who we spoke about in the video. With our HydroWorx system, we utilize this hydraulic lift chair to get patients in and out of the pool. Go ahead and transfer over here. Basically, it works off of a pressurized system. The chair rotates 360 degrees, so once we get up over the wall, we can swivel it around and lower him right down directly into the water. With spinal cord injury, spasticity can be a real issue, so we keep our water temperature a little bit higher, around 90, 92 degrees. Helps to relax the muscles and reduce the spasticity. Another way we help to reduce that is just by marching in place and starting to let his muscles relax before we get started walking. So again, Brock 5 months ago was only able to move his left quadricep muscle and slightly raise his left leg. He's got good movement in both legs now. The right side is still more affected, as you'll see as he starts to walk here as well. Let's go ahead and start our treadmill. This is 0.6 miles per hour right now. The left leg steps through nicely. He gets a little bit of toe drag on the right. We've tried a couple different systems as far as strapping that foot and helping hold the toe up, but he ends up triggering too much spasticity if we do that. So he's really learned to try and bend at the knee and lift his leg up higher to clear that right foot. Take you up to 0.8 miles per hour. Try to keep a nice big step with that right. Another benefit to the camera system is majority of our patients cannot feel where their feet are at on the treadmill, and we discourage them from keeping their head down to watch, and so they can keep their head up here. They can watch what the legs are doing and where they're being placed directly in the video screen, which helps with the feedback to the brain and their proprioception as well. As a patient progresses and is able to ambulate independently, then we can start to utilize the pool in other ways. One, to increase their speed or increase their kinematics. We can also start to challenge them in different directions. We often might have a patient do some sidestepping. I'm going to stop you here, Brock. We'll have you turn and face the mirror this way. Just going to challenge more of his hip abductor muscles, challenge his balance a little bit more, and proprioception as he's not looking directly into the camera as well. A little bit quicker step. Don't let the legs get behind you. Doing great. Okay, let's stop. Let's turn around this way. Try the other direction.
This side seems a lot harder. It's leading with that right, it doesn't bend.
Let's stop. We can turn them face forward. A lot of times we can use the water just to help with standing balance. We can get your feet a little bit closer together there. Let's have you stand straight up. Try not to hold on to the bars. Try just to bend the knees and come back up straight. A little bit of a mini squat.
1 second. Keeping them the feet together.
We can put it a little bit wider.
Okay. Let me just try to move it a little bit.
Can see as that right leg starts to fatigue, he still gets a lot of that bouncing and spasticity in that lower extremity, and
sometimes it helps to kind of isolate and put a little bit more weight through it. Sometimes not.
So, for very weak muscles that we're just learning to reactivate and re-strengthen, the water is a very appropriate and helpful tool with that. Let's just walk one more time.
Okay.
See if we can't get a little bit faster.
Sure.
This is now at 1.0 miles per hour.
Great for endurance, I'll tell you that much. Say, okay, walk for a half hour. Wear a guy out.
One of the main purposes of the pool and the water is to eventually progress them back to land. On land, Brock is able to walk with 2 forearm crutches now for up to about 300 to 500 feet, very short distances. In the water, he can walk for 10 to 15 minutes consecutively without fatiguing. So it's really good to build his endurance, and then we try to carry that over to the land though. So we go up one more time to 1.2.
Okay.
Nice job, and let's stop.
Thank you.
Okay, so that's how we utilize the HydroWorx pool in the case of Brock here.